I am Dr.Shweta Singh. I am an obstetrician and gynecologist and high risk pregnancy and infertility specialist. Today I am going to talk about the recurrent pregnancy loss. Recurrent pregnancy loss is defined as 3 or more consecutive miscarriages occurring before 20 weeks or loss of fetus weighing less than 500 grams. About 1% of fertile couple will experience recurrent early pregnancy loss. Recurrent pregnancy loss has been classified into two parts, primary and secondary. Primary means 3 or more losses with no pregnancy progression beyond 20 weeks. Secondary means 3 or more losses after a pregnancy that progress beyond 20 weeks, which might have ended in a live stillbirth. The global burden of miscarriage of a clinically recognized pregnancy is 12 to 15%, and the risk of recurrent miscarriage in reproductive age group is about 1% of the total population. And as we know, as the ages advances, the risk of miscarriage will be more. The incidence will be high. Around 3 to 5% have the chromosomal abnormalities in recurrent pregnancy loss, but single pregnancy loss may be as high as 40 to 50% in more than 40 years of age group. Spontaneous early pregnancy loss is about approximately 50 to 75%. More than the 80% occur beyond 12 weeks of pregnancy. 0.5 to 5% of spontaneous miscarriage are of recurrent type, and only 5% of recurrent pregnancy loss will be due to genetic causes. Certain causes of recurrent pregnancy miscarriage, certain forms like a biochemical pregnancy loss, empty sac, fetal loss, early pregnancy loss means the less than 12 weeks of gestation age, late pregnancy loss means the greater than the 12 weeks of gestation age, mid-trimester loss, late fetal loss, and pregnancy of unknown location. Now, the different causes of recurrent pregnancy loss are of types: parental chromosomal abnormalities, certain anatomical factors, hereditary and acquired thrombophilia, antiphospholipid antibody syndrome, certain immunological factors, endocrinal factor like untreated hypothyroidism, uncontrolled diabetes mellitus, PCOS, infection like endometritis in 0.5 to 5% cases, lifestyle and certain environmental factor, maternal systemic diseases, male factor, and some factors are unexplained. Now, the causes of recurrent pregnancy loss, the first factor is the genetic factor. More than half of the early pregnancy loss is because of chromosomal abnormalities. In few cases, abnormality may be inherited and responsible for 2 to 4% of the cases. 3 to 5% congenital and acquired anatomical defect like a septate uterus, uniconvate uterus, biconvate uterus, arcuate uterus, uterus associated with the fibroid and intrauterine adhesion. Factor 5 and the immunological factor like factor 5 latent deficiency, prothrombic gene mutation, protein C and S deficiency, antithrombin C. And diagnosis criteria for the diagnosis of antiphospholipid antibody syndrome is clinically thrombosis, pregnancy related morbidity, lab criteria, presence of the anticardiolipin antibody, IgG, IgM, lupus anticoagulant, and done on the 2 or more occasions at least 6 weeks apart. Presence of at least one clinical and one lab criteria. If positive, we have to start the heparin and aspirin as soon as possible. Prerequisite for successful pregnancy: maternal recognition of an embryo leading to protective immune response. Implanting embryo inherit its antigen for both mother as well as a father. Paternal antigen are identified as a foreign antigen by maternal immune system. So, in order to prevent the rejection of a pregnancy, this immune response need to be modulated. In unexplained pregnancy loss, dysregulation of the immune system would be responsible. Certain hormonal problem may lead to the recurrent pregnancy loss like the luteal phase defect, uncontrolled diabetes mellitus, hypothyroidism, PCOS, high androgen levels, hyperinsulinemia. So, the thyroid dysfunction, the level of the TSH should be restricted up to 0.1 to 2.5. Second trimester 0.2 to 3, and the third trimester 0.3 to 3.5. Presence of antithyroid antibodies associated with an increased risk of miscarriage. So we have to rule out all the hormonal problem and treat appropriately. So the common in recurrent pregnancy loss are inappropriate corpus luteum function, means the decreased production of the progesterone that leads to inadequate endometrial preparation. As we all know that the endometrium is the bed for the embryo. So if it is not adequately formed, means if the progesterone level is inadequate, then it leads to miscarriage. So, role of viral or bacterial infection in recurrent pregnancy loss is very controversial because TORCH, mycoplasma, listeria can cause sporadic pregnancy loss. In case of chronic endometritis, 71% in recurrent pregnancy loss. Certain environmental factors like smoking, heavy alcohol consumption, caffeine, stress, and both BMI high and low is responsible for the pregnancy loss. Certain maternal systemic disorders like systemic lupus erythematosus, celiac disease, renal and liver disease itself leads to cause of recurrent pregnancy loss. Certain male factor like sperm DNA damage in male germs line, elevated serum chromosome aneuploidy, and apoptosis. Certain causes are unexplained like currently no treatment. 60% of the next pregnancy are successful without treatment. Aspirin has a no effect. Immunotherapy not helpful. New drugs. Anti-100 improved maternal fetal tolerance, and genetic screening pre-gestational diagnostic test. Diagnosis of recurrent pregnancy loss we can make by the detailed history, physical examination, calculating BMI, and rule out other causes of hyperandrogenism, breast examination, and pelvic examination. So, for certain investigations are also required to rule out the causes of recurrent pregnancy loss. And after investigating, the treatment of recurrent pregnancy loss is tender loving care, empathy, integral part of the care. We will provide the folic acid, vitamin B12, metformin, lifestyle modification, aspirin and low molecular weight heparin, thyroxine for thyroid peroxidase, and treatment of the specific causes. For the genetic factor, we will go through the genetic screening, FISH to detect the numeric and structure chromosome anomaly, PCR to monogenic disorders, and donor gametes. So, is a parental karyotyping is needed. Royal College of Obstetrics and Gynae no longer recommended except when the chromosomal abnormality detected in the product of conception. Treatment options in recurrent pregnancy loss includes anticoagulant, heparin, aspirin, certain antibiotic for treatment of bacterial vaginosis, supportive care, bed rest, vitamins, folic acid, supplementation, and certain lifestyle modification. And sometimes surgery is also required in case of uterine septal dissection, hysteroscopic lysis of intrauterine adhesion, and may be beneficial in anatomical etiology for recurrent pregnancy loss. And certain immunotherapy in case of immunological causes, progesterone in case of luteal phase defect. Nowadays we are using dydrogesterone as a progesterone preparation. Now certain progenic effect is a progestational, means we are using for the pregnancy. Okay, the first of all we have to rule out the cause and we will treat the patient accordingly. Thank you.